Hi, I'm Vanessa Weaver, and I'm going to be doing a physical head-to-toe assessment on my patient. Prior to the video, we did the health history, health assessment, and generalized survey, along with the social history and medications that she takes daily and all of that. So I'm just going to start with just our physical assessment. Is that okay with you?
Yes.
Perfect. Okay, are you in any pain today at all?
No.
So 0 to 10, 10 being the worst pain you've ever felt.
0.
Okay. You did say during your health history that you do work out, so do you have any issues, at all with working out?
No.
None at all? Excellent. Okay. So the first thing I'm going to do is I'm just going to look at your hair, make sure that there's no balding or any spots. I'm just looking at your skin, your neck, and your arms. Good. If the patient was wearing a Johnny coat, I would be looking at the chest, underneath the breast because she's a female, and the abdominal folds if she had them. And in the groin as well, I'd be looking at from the back of the head all the way down her back to her bottom. If she was wearing the Johnny coat, I would also be looking at her thighs, her knees, all the way down to her feet, which everything looks great. So have you had any problems with acne in the past?
No.
No? Excellent. Okay. So your skin looks clean, dry, and intact. That's good. So we're going to start with just assessing your eyes. Do you have any pain with your eyes?
No, I do wear glasses.
Okay. How do you wear glasses?
For distance.
For just distance. Okay. No redness. That's good. Just look straight at me. I'm just going to check your pupils. Good. Both pupils are reactive. Excellent. And then if you can just follow my pen, just don't move your head. Just checking your ocular movement here. Good. Good. Do you have seasonal allergies at all?
Yes.
Okay, what kind of, do you have any eye symptoms with those?
Yeah, they do get red and itchy.
Okay, and what about your nose and ears? Any?
My nose gets stuffy, but nothing with my ears.
Okay, I'm just going to take a look at your ears, just looking at the general appearance. Everything looks clean, dry, and intact, which is good. If I had the device in the office, I'd be looking in the ear, at the inner ear canal, looking at the tympanic membrane. You would want to see no bulging, no exudate, no pus, no anything abnormal. You want to see something that's clean, dry, and intact and pink. If I had the device to look in the inner eye, I'd be looking at the cortex of the inner eye. I would be looking for it to be amberish, orange color, and good perfusion to the whole eye. But her eyes are intact. There's no redness, there's no itchiness, and she has no pain with her ears either. So you have something with your any sinus issues?
Not as of right now, no.
Okay, I'm just palpating the frontal sinus here. Good. I'm just gonna, if you could just look up a little bit, I'm gonna take a look inside your nose here, which the airway is open, no runny nose or anything, right? No. Okay. If I had the device to look in the nose, I would take a deeper look inside the canal to see an open airway. I'm gonna look inside your mouth if you don't mind just opening, sticking your tongue out. Good. If you could just look up and then down, side to side, please. Good. Do you have any history of sore throats?
No.
No.
I mean,
okay.
I get them sometimes just from getting sick, but nothing like
Okay.
constant.
If we were in the office and I had a tongue depressor, I would be moving the tongue up and down, side to side. And then to test the gag reflex, which I will not be doing, I would take the tongue depressor, put it into the back of the throat to touch the pharynx, and create that gag reflex. And I'm sure yours is intact and everything. Next, I'm just going to take a listen and also palpate your temporal arteries here, which they're good. I'm going to also do the neck, one carotid at a time. And then if you could just swallow for me. Good, swallow's good. And your thyroid doesn't feel enlarged. I'm just going to palpate the lymph nodes coming down here. And if you could just lift your arms underneath. I know it tickles, I'm sorry. None of the lymph nodes are enlarged or puffy, which is good. I'm just going to take a listen to those arteries, okay?
Sure.
Everything sounds good. No bruises are there. All right. So next what I'm going to do is I'm just going to take a listen to your heart sounds.
Sure.
We're going to listen to the aortic, pulmonic, Erb's point, tricuspid, and mitral valve. Okay.
Sure.
Have you had any palpitations in the past or
Never.
anything? Okay.
Never.
Any chest pain now or in the past?
Never.
Okay. I'm just going to take a quick listen with the diaphragm first. If you could just turn this way just a little bit. Perfect. Good. I'm going to listen again with the bell side just to see if I hear any abnormal heart sounds to the same points. Next, what we're going to do is we're also going to listen to your lung sounds. I'm going to listen to 6 points on the front, so 1, 2, 3, 4, 5, and 6, and then we're going to listen to 10 on the back.
Sure.
Okay. Do you have any shortness of breath at all?
No.
Okay. Take a quick listen. If you could just give me a deep breath. Good. If I was in the office and the patient was wearing a Johnny, I would move the breasts more out of the way if necessary. Can you just turn around so I can listen to your back? I'll just turn just a tad. That's good. Okay. Yep. So again, I'm going to listen to 10 points. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. I know the breaths get to be a lot, so I'll try to go slow. Okay.
That's okay.
So I'll let you know when to take a breath. Go ahead. Good. Very good. Doing okay?
Yep.
Your lung sounds in the front and in the back sound totally clear. No advantageous breath sounds at all. I'm going to also percuss all of the lobes, okay?
Okay.
So I'm just going to. No dullness. Everything seems to be resonating, which is great. All right, perfect. Excellent. And I'm just going to do the front. Again, if I was in the office, I would probably have a better angle if I move the breasts out of the way, but just for video purposes. And again, no dullness, everything resonates. Excellent, perfect. Okay. So now I'm going to also assess your GI system.
Sure.
So if you can just lay down, that would be great. And then just kind of scooch this way just a little bit. Perfect. Oh, I might have to come down here, which is okay.
Check and see how my camera.
Oh yeah, let me just make sure the camera didn't turn off because the screen went dark. Good, okay. All right, so the first thing you're going to want to do is you want to inspect the abdomen, which if the patient was wearing a Johnny coat, I'd just be looking for any distension, any lumps, bumps, or anything like that. First thing you would want to do, though, is listen to all 4 quadrants for the bowel sounds. For video purposes, I'm going to have the patient come up on her side so I could show where to put the stethoscope. So you could turn on your side.
Oh, turn it.
Mm-hmm. Good. Is it good? So if the patient's belly button is here, you would want to come up here and listen to all 4. And you want to move the stethoscope in the way the bowels are flowing. Good. Next thing, what you're going to want to do is palpate. For palpation purposes, just to show where I'm palpating, I'll have the patient stay on their side. In the office, I would normally have them lay completely flat. So you would do light palpation in all the quadrants, just to make sure that there's no lumps or bumps, masses, or anything. Any pain?
No.
Good. You ever have any constipation or
Once in a while.
any bloating regularly?
Yeah.
Okay. Are you passing gas though?
Yes.
Okay, excellent. You would also want to palpate over the spleen here and the liver.
What would happen if I didn't pass gas?
We would have to do some further examination just to make sure that you didn't have a blockage, make sure that you still had motility going on in your GI
So it's good
system.
that I'm passing gas.
Correct. So when was the last time you had a bowel movement?
This morning.
Excellent. Do you have any trouble voiding
No.
Okay.
It only happens sometimes.
Right. And I think it happens to all of us, which is okay.
Okay.
But if it starts to become a regular thing, it would definitely be something you would want to come back in for.
Okay.
I won't be doing it here, but you would also want to do deep palpation, which would be really getting in there and feeling for those masses or any abnormalities. But her abdomen is soft, not distended, and she is indeed, according to her, passing gas. And bowel movements are regular?
Yes, they are.
Excellent. If you want to just lay on your back. Perfect. So now, for video purposes, I'll have her turn again, but I would have the patient lay on their back to listen to the aorta, the renal arteries, and the iliac arteries, also the femoral. But before I do that, I'm just going to percuss as well. So I'm going to percuss in those same spots. There's no dullness. Everything is resonating. You want to percuss in a few areas. Any pain?
No.
Excellent. So I'm going to take a listen to all those arteries, okay?
Okay.
So up here is your aorta.
Okay.
No bruit, which is good. The renal arteries.
No what?
Bruit.
What is that?
That is, hang on. Did you just eat dinner?
Yeah.
Your bowel sounds are going crazy.
Oh, they are?
Yeah, so those were the two iliac, and then down here would be the femoral. Sometimes bruits are an audible sound of blood moving through, but it could happen if there's like a blockage.
Oh,
or...
really?
Yeah. Yeah.
You can hear it like going through the...
Yes, you can hear it. It's like a vibration sound.
Oh.
Yeah, but you don't have any of that.
Is that normal to have that?
No. It usually indicates something bad, like a blockage.
Oh, so you should not hear that.
No.
Okay.
So I'll also palpate the kidneys right on the back here. So I slide if you could just move your arm. Oops, sorry. Slide underneath here. And same thing on this side as well. If you could just sit up and turn around, that would be great. So I'm also going to check for here CVA tenderness, which is tenderness of those kidneys. So any pain?
No.
How about on here? No. Good. And then I'm also going to do the firmitis test, which is for making sure that I can feel the vibration of her vocal cords. So you can cup your hands like this, or lay them flat and just say 99.
99.
So I can feel your vibration back here, which is great. Okay, so you could go ahead and turn and face this way.
Sure.
Sorry to make you go all over
That's
the place
okay.
here. Next thing we're going to do is we're going to look at some range of motion. So like you said, no issues with your joints or anything working out daily.
I get sore just from working out, from working out, but no like joint pain, no.
Okay, so if the patient was wearing a Johnny coat, I would be looking at the shoulder joints. I could see her elbows. There's no swelling. Everything looks symmetrical. Same thing with the wrists. If you could just extend. I would also be looking at her hips, which they look symmetrical. The knees look symmetrical, and so do the ankles. So everything looks good. There's no problems with the skin. So let's start with the neck as well. No neck pain or anything?
No.
Okay. So if you could just take your neck and just bend it side to side. Yep. And then just for up and down. For that flexion and extension. So that's your extension and your flexion. Good. So now we're also going to do the strength test. So just lay against my hand and pull. Good. Yep, same. Good. And then push your chin down and up. So you have good strength. Can you shrug your shoulders? Perfect. And can you extend your arms over your head? Good. And then we're also going to do the same thing. Push up. Excellent. So she has bilateral strength for her neck and her shoulders. Next thing we're going to do is we're going to look at the arms and the elbows. So if you can do extend forward and just do a bend. Any pain or anything?
No.
So this would be a supination, and if you could just pronate your hands and then back to supinate. Excellent. Now with your wrists, can you flex and extend? Good. And then just push against my palms. And then flip your hands the other way.
I'll do it wrong?
Yep,
Sorry.
just like that. Perfect.
Sorry.
So you want to get that extension going.
Oh, okay.
Okay. But she's got bilateral strength in so far the upper extremities and the neck. Let's move to the hips. If you can just lay down if you don't mind.
Sure.
Okay, so we're going to test your flexion and extension of your hip joint. So what we're going to do is we're going to bend this leg. This would be your flexion.
Okay.
Any pain?
No.
Excellent. We'll do the other leg. Very good. Perfect. So now we're going to do adduction and abduction. So what we're going to do is we're going to have you take this leg and swing it out.
I want to kick you.
Any pain?
No.
Perfect. So that would be your abduction with a B. If you lift this leg and slide this one underneath it, that's your adduction.
Okay.
Perfect. So if you could do the same thing with this leg, extend it out for abduction. Lift this leg, slide this one in for adduction. Beautiful. If you could flip over on your back. Good. Doing okay so far?
Yes.
Okay, so we're going to do extension of your hip. So if you can lift this leg, you can bend it as well.
Oh, I'm going to lift it all like this?
Yep. Perfect. Now, if the patient needed to bend their knee and lift, it would be the same thing. It'd be okay. If you could do it with this one as well. Excellent. If you could just bend. Excellent. Perfect. Okay, you could sit up and just have your legs dangle over the side here. So we're going to check the range of motion in your knees.
Okay.
So if you, if you can just extend one leg at a time. I think it's on the record leg.
Okay.
Perfect.
See my legs in it?
I think so, yeah. Okay, put them down. Good. So now we're going to do your ankles. Okay. So if you can...
I'm going to come up.
That'd be okay.
Is that okay? I'll go like this?
Or you could sit back and just have your legs sit out.
See the camera.
Good. So just dorsiflect up.
Yep.
Plantar flexion is pointed down. Perfect. And then inversion, yeah. And then exversion. Perfect. So if you can just push against me.
Yeah, go higher. I want to make sure.
Push against me.
Okay.
Like a gas pedal.
Yeah.
And then pull up.
Okay.
Perfect. So you have bilateral strength in all of your joints and extremities, which is excellent. I'm sure you are very, very with it at the gym.
Yes.
Okay. So the next thing we're going to do is we're going to do some range of motion, but with walking and stuff. So I just need you to dangle your legs over like this.
Sure.
Take your foot and put your heel on your shin and just slide down. Yep, and then same thing on the other side. Perfect. I'm going to stand up just next to you, and I'm going to point this down just so we could see. Open the... keeps turning off. So we could see your legs. Okay. So if you can, stand up and just walk, but try to stay in view if you can.
Like this.
Yeah. Good. And then walk back, but walk on your heels. Good. Walk back the other way and walk on your toes. Good. And then turn around and do heel toe, heel toe. Excellent. And no pain or anything?
No.
Excellent. You can have a seat. So you're very stable. You have a very steady gait there. So next thing we're going to do is we're going to move on to neuro. Okay?
Okay.
Any questions so far?
No.
Got my pen light here. So next thing we're going to do is we're going to look at your deep tendon reflexes. So you have reflexes like with the little hammer. I don't have a hammer, so I'm going to be using my pen light as a hammer. So we're going to start with the ones in the bicep here. So I would give it a tap. Good. In the back. And if I had the hammer, you would have a little jump going here. Usually you might know that with the knee.
Yeah.
Back here. So I'm sure if we had the real thing, you would be +2 for reflexes there.
Okay.
We're going to also do it in the knee.
That actually did this one.
Oh, cool. Okay. And then if you can lay down and stay on your stomach. Oh, we're going to do the Achilles. Did do it a little bit?
A little bit. Yeah.
There you go. So you got +2, very reactive. You can swing over. So we're also going to look at the cranial nerves. So cranial nerve 5, if you could just, more so face this way, just clench your teeth. Perfect. If you could squint your eyes. Perfect. So most of the other cranial nerves we were already looking at because you're able to talk and move and you make facial expressions and stuff like that. For cranial nerve 7, can you raise your eyebrows up like this? Perfect. And then can you frown? Perfect. So that would be another cranial nerve that is working. The other thing that I want to test is your hearing, if you don't mind.
Sure.
So if I had the real thing, which would be the fork, but we'll use my pen light, you would hold it up here. It's the Weber and Rhine test. I would flick it. You would have a vibration that you would hear in both ears, but it would have to be equal.
Okay.
Yeah. When was your last vision assessment?
A couple months ago with the eye doctor.
Okay. Did you do the test on the board with the letters?
Yes, I did.
Okay. And how did you do with that?
Fairly well. I mean,
okay.
like I said, I do have vision
just
distance problems, but it was okay.
Just the distance. Okay. So if I had the actual chart, I would have the patient cover one eye, read each line until they couldn't read it perfectly, and then that would determine what level of vision is in that eye. Cover the other eye and do the same thing. Good. Any questions?
No.
Okay. So next thing we're going to do is we're going to look at sensory function in your face, arms, and legs. I'll use my pen light here. So this round side is going to be your dull. The metal is going to be the sharp. So when I put it on your skin, you're going to tell me what you feel with your eyes closed. Okay?
Sharp. Dull. Sharp. Dull.
Good. So you have good sensation that's intact in your face. We're also going to try it in your arms.
Sharp. 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 Dull. Sharp. Dull. Dull. Dull.
Good. All right. I'm I'm going to do it in your legs as well, so if you could just close your eyes to make it more.
Do, do, chirp, 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 do, do.
Perfect. So you have great sensation here. Do you have any numbness or tingling anywhere at all?
No.
Good. Okay, good. And no injuries related to your spine ever?
Never.
Okay, excellent. So the next thing that we're going to do is we're going to do another exam where I'm going to write something on your hand, and you're going to tell me what it is without looking at it.
Okay.
Okay, it's called graphesthesia, if I'm saying it correctly. Okay, so just don't look. I'm going to show it to the camera, though, so they can see what I'm doing. Okay.
Figure 8.
Perfect. We'll do something on this one. Ready? Do you need me to do it again?
Yes, please.
Sure.
A triangle?
Perfect, yeah.
Okay,
yeah,
that was the
that's
first time.
So the other test we're going to do for sensation is going to be, I'm going to give you an item and you're going to tell me what that item is without looking at it.
Okay.
Okay? That's called SNHU, if I'm saying it correctly, I promise. I'm trying to not botch the names here. Okay, so ready?
Scissors.
Perfect. Excellent. Okay, so now we're going to move on to psychiatric. Normally in the beginning of an exam, I would ask the patient a series of questions like, do they know who they are, why they're here, time of day, anything to tell me if they're alert and oriented times 4. So I'm going to do that now. Can you tell me your name and date of birth?
AW 4/21/1999.
Okay, do you know why you're here?
Yes, for a checkup.
Perfect. Do you know where we are?
Mid-State Hospital.
And do you know the year?
2021.
Perfect. So the patient would be deemed alert and oriented times 4, and this would give me, at the beginning of an exam, a very great indication of how well this will go with recall of information, answering of questions. I'm going to ask you just a short-term question, just to check for short-term memory.
Sure.
So how did you spend your last birthday in April?
At the casino.
Perfect. Did you have a good time?
Yes.
Sounds fun. And for a long-term memory, who was your first grade teacher?
Miss Smith.
Perfect. So that was excellent recall for both. The next thing that we're going to do is we are going to do a comprehension and attention test, just a little thing to see if you can follow a command and keep your attention focused. So we'll do the comprehension one first.
Sure.
So on this piece of paper is a just small instruction. Read the instructions and do what the paper says.
Do you want me to read it out loud or just do it and then tell
No,
you?
just do it and
Okay.
that would be okay. Perfect. So the paper did say to take this paper, put it in your left hand, fold it in half, and put it on the floor.
Yes.
So excellent. So good with following that instruction. So
Okay.
we're also going to do the attention exam. So if you can count back from, I know it's difficult, count back from 100 by 7.
Okay.
By 7s, all the way down to
Okay.
the bottom.
100, 93, 86, 79, 72, 65, 58, 51, 44, 37, 30, 23, 16, 9, 2.
Perfect. Very good. I don't think I could have done it, but good for you. Okay, and then the last thing that you want to do for your head-to-toe assessment is just thank your patient. Thank you for being my patient today. Do you have any questions or concerns for me?
No, I think I'm all set. Thank you very much.
Perfect. So then that would be the end of the assessment. And that's it.
Okay.